If you have a symptom or a finding that you do not understand that is new, don't wait too long before you consult with your physician. To get the optimal care for diabetes, you have to be part of a team. You have to be able to assess your options, discuss them, and implement them. As part of this team, you have special responsibility in that you need to make sure, as a patient with diabetes, that you have follow-up visits, consultations, regular blood tests, and general level of engagement. Do not give up, keep engaged, read all the materials that you have available to you about diabetes and discuss them with your providers. But most importantly, you have to be, as a patient with diabetes, engaged and proactive. Diabetes, in addition to being a condition affecting blood sugar, touches on many organs in the body. Diabetes increases the risk of heart disease, kidney failure, nerve damage, and so on. Therefore, if you have a symptom or a finding that you do not understand that is new, don't wait too long before you consult with your physician. It is important to be proactive with diabetes and to be ahead of possible complications. So if there is a change in your body, don't wait too long, call your doctor.